Good afternoon, everyone. I am thrilled to welcome you to today's critical and insightful webinar. Before we begin, let me ask, how can we help individuals trapped in addiction break free and heal the deep traumas often at the root of their struggles? What if TCM could offer a powerful approach to treating both the addiction and the underlying trauma? If you've ever wondered how to effectively treat patients struggling with trauma-related addiction, you're in the right place. My name is Myra Chen, your host and moderator for today's eLotus webinar. Here at eLotus, we have been offering premium CEU courses for over 30 years, and with more than 200 expert speakers and a library of over 700 courses, we continue to bring you trusted, high-quality educational content. Today's class, Breaking Free from Drug Addiction and Substance Abuse with TCM, is designed specifically to help Chinese medicine practitioners effectively approach and treat patients who have developed addictions as a result of trauma. This course will cover a range of addictions, including drug, alcohol, and food, and provide insights into how to better understand and engage with patients suffering from trauma-related addictions. We are honored to have Mark Mastrangia with us today, a practitioner who brings a wealth of knowledge from his extensive study of Chinese medicine, Eastern philosophy, and martial arts. Mark's journey began in the Eastern U.S., where he earned his degree in biology from the University of Connecticut and honed his skills at the Swedish Institute. His time studying in Beijing and working at Guoyitang Hospital provided him with invaluable insight into holistic approaches to healing. Mark Mastrangia has a deep commitment to treating trauma and addiction, and today he will guide us through the complex ways in which TCM can help address the root causes of addiction for lasting healing and recovery. He has been speaking with us since 2020 and offers a wide selection of courses that you can check out. I will post a link in the chat room for more information, including previous classes on Shanhan Lun acupuncture, channel theories, acupuncture for wind-being diseases, and more. Before we begin, a quick reminder to set your chat from hosts and panelists to everyone so that everyone can be part of the conversation. If you have any questions during the webinar, please use the Q&A box. And the quiz for CEUs will be available the next business day late afternoon for everyone with qualifying attendance. Now, let's begin today's webinar, and please join me in welcoming Mark Mastrangia.
All right. Are we going to do a test or are we just going? I know we were going to do this test, but I guess we're not. Can everybody see me? Can everybody hear me?
Yes, we can. Hi, Mark.
All right. Good, good. All right. Then I guess we'll get started here. Let me open this up and share my screen here. Okay. Here we go. All right. So should I go full screen to this? Bear with me for a second. Yeah. Okay. So welcome to today's webinar. We're going to be talking a bit about drug addiction. I know it's not the most popular topic, but it's something that definitely needs to be talked about, particularly because of the fact that this is such a big issue, very prevalent in society today. And I actually have a lot of experience with this because I come from a family of a lot of drug addiction. I myself have never had an addiction issue with drugs or anything like that. I've honestly never even taken them, as wild as that sounds. A lot of people are like, what? You've never even smoked weed? Never even smoked weed, never even smoked cigarettes. This was never my thing. But I grew up in a family of heavy drug addiction and a lot of hardcore drugs, crack cocaine, heroin, things like that. And so I have a very close, I have had very close experiences with people who go through these things. And so a lot of what I'm sharing with you today is uh, me explaining what goes on through the lens of Chinese medicine, but then also kind of I'll add things as far as my experiences go with treating people, family members, friends, things like that, who have all had major issues. Because I know that you guys will see a lot. The drug of choice generally today is heroin type things or fentanyl, and these are downers. So we're going to talk a little bit of the difference between people who move towards downers or uppers, or even things like OCD, which can be comparably uh, associated with drug addiction. I don't know how many of you know this, but obsessive compulsive disorders are oftentimes treated in uh, drug treatment centers. The person might not actually have a drug problem, but they have a very severe OCD problem, and those people also are oftentimes treated at drug centers. So there's a mixture of these things. Food is another addiction that can happen. Coffee, right? The need for alcohol, cigarettes, sex. Sex addictions are a big thing. A lot of people don't like to talk about them, but the rise in the availability of porn creates sex addictions. And somebody is trying to look for something to either escape pain, to distract themselves, or to find pleasure. These things become easier and easier, and they become addictive to many people because you get this feedback mechanism of pleasure, and then they move towards it, right? Or it helps them numb the pain that they're feeling. So we're going to touch on a little bit of this today, but we're going to talk about this mainly in the context of the psychosocial development of somebody and how trauma at different points in time can affect them, pushing them towards particular addictions and how we can treat that underlying trauma. Because most of the time, when you meet somebody or somebody comes into your office who has a severe addiction, whether it's substance abuse or whether it's a sex addiction or whether it's food addiction or something else with OCD, it's normally they're trying to cope or compensate for something that has affected them greatly. It's very rare that you'll meet somebody who's like, "Oh, I'm addicted to this thing. I just I don't have any reason for it." Like even coffee, for example. People take on coffee because of the fact that, they are under a lot of stress. They can't feel like they can compete in life unless they have this thing that pushes them to go, right? And so that can become something that can even become addiction. Tea, right? I love tea. In fact, I'm drinking tea this morning, but this can become an addiction, right? Everybody has something small that they're addicted to, but it's good to understand where this happens, how this happens, and then how to help people kind of become free of that if they choose to, right? Because the other thing about treating addiction is as much as you're going to treat people as a physician, you also have to look at, does the person really want to get rid of this? Because if they don't, then it's going to be very difficult for you to treat them. If they do, and they're willing to work with you, then you can have great success. So just going to check this chat here. All right, here we go. All right. So earliest writings of addiction. Earliest writings of addiction in Chinese medicine come from the Ming Dynasty, with herbal analgesics and things that help people to get away from pain, right? So later in the Qing Dynasty would end up losing its foreign wars, particularly the Opium War, and the British and a lot of foreign powers would push a lot of opium into China, causing a major addiction, and causing its population basically to become addicted. And so the Chinese and the Qing officials, and I differentiate those two because technically the Qing people were at the time Manchurian; they didn't consider themselves Chinese. They were struggling with this kind of concept of how to treat this. And so many different ideas came up. And you can look at this idea of a loss of a war and external powers taking over as a big trauma, right? You're kind of looking at yourself as, well, what do I do? How do I do this? A lot of times we look at this from an herbal medicine point of view of is it sour? Is it this? Is it that? But there's also the concept of the psycho-emotional part. And I think that's the biggest, most important thing with most drug addiction, rather than the flavor of the drug, right? These things are kind of more important. So I'm trying to hold on real quick. I'm trying to see my chat. Here we go. Sorry about that. All right, here we go. So, uh, trauma. In the case of people, you can have a lot of unresolved trauma. Sorry, go back. Here we go. You can have unresolved trauma. I've lost my mouse here. I'm trying to be able to click around on this page. Sorry. Uh, Here we go. You can have a lot of unresolved trauma in somebody that causes them to alter their life's path, right? And this can create a number of things. So if this injury is severe enough and it's left unresolved for a long time, it can eventually make its way into a subconscious, altering the person, altering the way they think about themselves, pushing them off their basic life path, their me, right? Their destiny, right? It pushes them away from this concept of me. And they kind of become somebody who's influenced by something, but it's not their real path. They feel very uncomfortable with it, right? This will over time affect the person's spirit, right? Their shed and their seeing, their nature, who they are, right? So these addictions will create these can create addictions to try to cope with this. So it could be physical, emotional, chemical, right? To reduce the pain or increase the pleasure, right? You can have people who become uh, very addicted to adrenaline, right? Adrenaline junkies. People who need, alcohol to deal with people and talk in relationships. All these different things can become addictions, right? So mentally, physically, spiritually. So the concept of trauma and the jingmai, right? The primary channels or the low channels, the eight extras, whatever. Think of the primary channels in today's lecture as the conscious life we lead, the everyday life, step by step, where I go, what I do, right? This is the concept of the primary channels. What I'm doing every day, how do I interact with people around me, those basic things, right? But if an injury happens that we can't resolve or come to terms with in one way or another, and we can't push it out of the primary channels. This even includes external pathology, right? The body will try to move it off the primary channel, our everyday conscious life that we're leading, and store it away. Yeah, this is a problem. This is an issue. I got maybe, it's a woman who gets pregnant while she goes to college and has to drop out. She has to raise this kid. This kid now is her daily conscious life. Going to college is something that gets put in the back burner, right? That gets pushed off into latency in the back of her mind, and she always regrets it. She has a lot of emotions about it, but she knows she has to pay the bills and work and do these things. So her primary channels are focused on this kind of daily life survival mechanism and taking care of daily things. So that those emotions about that might get pushed to the low channels, right? And what I want to suggest for you guys who are taking this class is this is really a sort of a two-part class. The first class, I went over a lot of the Lumai concepts and the teaching by the eight extraordinary concepts. So what I would suggest is go back and look at that class because today's class is going to be more focused on addiction, and we're not going to go over every one of the channels. We're going to go over very particular things. But if you want a more in-depth on each of those when it comes to this, go and check out that class. That'll give you more information there. So these things can be held away. These traumas can be held away. So they can be pushed into the low channels. And when they're pushing the low channels, then over time, if they're not resolved, they can slowly make their way to the source, right? We have a source low connection, and they can move into the source point of whatever that low channel is, the lung source, if it's grief, or even the large intestine source, the stomach or spleen source, if it's obsession and constant thinking about something. And eventually, when it moves into that source point, that's what? Yuan Qi, right? That's source Qi. And that will eventually move into the Ren and the Du. So you have this concept. Or in some cases, trauma can move into the eight extraordinary vessels. And you can develop, before you even can develop your intelligence and your understanding of kind of social life and everything, you can develop these trauma that go into there. So that's something that you will see. Hold on here. My my I can't see the chat. I'm sorry. It goes in and out, but I guess I don't need it right now. All right. If you guys ask questions that I don't answer, it's because my computer's acting funny. I have kind of an old computer and it doesn't necessarily uh here we go. Oh, it's just Myra. Okay. Blah, blah, blah. Let's get this out here. All right. So you have this concept of these unresolved traumas. So source low, as we mentioned. And we're going to go through some of these slides rather quickly because I drew you guys up a lot of slides and we only have 3 hours. So these low vessels are able to, if they're unable to hold things, they'll transfer it back into the primary channel. We talked a lot about that in the first class on trauma. So go check that out. And it can affect source chi, it can affect internal pathways of the primary vessels. It can affect its yin yang pair. So a lung issue can affect the large intestine channel and vice versa, right? Example here, unresolved grief from rejection in a lung low can empty into its primary channel, enter lung 9, and even transfer to large intestine 4. And then you'll start to see issues between the two channels, right? So other things, constitutional issues. Certain trauma can affect the constitution of an ancestry line. So this can be a history of addiction in a family, right? We know this. This is a common thing with drugs. Is you get a history of addiction in in a family line, right? This is a very common thing. Also, history of allergies. We talked about this in the last class we did, how you can have a history of allergies. Also, a history of repetitive abuse. We know that oftentimes abused children will grow up to be abusing parents, right? So all of these things are very connected, even though they might be different things that happen. They're connected in this constitutional factor. You can look at it as an extraordinary vessel issue, or even a low vessel issue, depending on if you look at it as source low, right? Being passed down through these experiences, right? Before you can even conceive them, right? You're very, very young. This abuse happens to you when you're first born, when you're, 3 months old, 5 months old, and it continues on. But those very early kind of conditions are what can affect you. Or even, for example, one of the things is uh, basically a fetus who is affected, a baby in utero who's affected by the drugs their parents take, their mother takes, or even their father does, and the smoke gets into the mother's lungs, these type of things. Um, so even if it's not in a line or inherited traits, trauma in utero, like I mentioned, could be early childhood development in the constitution. They can affect the development of the constitution. So exposure to drugs or violence. A mother is beaten while the child is in utero. That can affect, you know, the child, and eventually the child can grow up to have these issues, even though maybe they themselves were never directly in contact with it. Between, say, for the person, the abuser doing the beating, whether it's the father or somebody else, might not directly, strike the baby, but the baby can feel the mother's emotions, right? And this will affect them. So addiction is desires, right? This is kind of this concept in Chinese called "yu." Where do they develop from? At a constitutional level, you have your desires of what you want to do. This is your qi jing, your will. You want to go out and do things. In this case, these desires, if they're rooted in that, you're going to look at things from an extraordinary point of view. However, if these desires come from environmental effects, everybody else around me has this, I want to do this too. I want to, you know, smoke or drink with my friends because I feel the pressure, I want to fit in, or this or that. This is an environmental effect, right? And this is based on social influence to conform. This would be more yin qi. This would be more law or primary vessel treatment. So, for example, if you have somebody who talks about needing to do alcohol so they fit in with their friends when they're at parties, or else they don't feel like they fit in, that would be an environmental effect. But if you notice that this comes from very early, early, early in life, you don't really see it as something that's a direct environmental effect. Maybe it's something that happened very early, or you notice that it comes from through the family line, right? Then that would be more constitutional, right? Sorry, here, I just want to check these messages. For whatever reason, um, oh, okay. Oh, okay. Here we go. Sorry, I just want to make sure I'm not missing any of these questions. Um, like I said before, I've got a lot of slides in here. We won't go through all of them, but you guys can use them to refer to, and you guys can go to my previous class if you want to check that out. So addictions and their effects on Jing and source. Many addictions tend to consume Jing, right? Look at upper chemical substances. These people have addictive personalities in the sense they like major spikes in yang, right? They got to do this, they got to do that. They tend to go, uh, cokeheads, for example. They want to keep going, keep going, keep going. Their personality is very type A, go, 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 go personality, very yang, very, you know, do my, so to speak. And they want to go out, they want to do things, they want to conquer the world, they want to do the best. They are very, generally type A personalities, very competitive, right? This is the concept of who these people are. And so they're stimulating this. This is their character. Therefore, they tend towards upper substances, right? Uppers, these things that stimulate them, right? The Ritalin, the Adderalls, the cocaine, these type of things. Downer substances. People who tend to be more sort of introverted. They tend to be more depressed. You know, these type of people. A lot of times you'll get in stasis in these people. They tend towards more downer substances, things that can numb them from the pain and give them analgesics. So in this case, you're going to find downer substances will strongly affect the yin and cause damage to the red mind, right? And in that case, you're going to find a lot of yin stasis. Whereas with the uppers, you're going to find a lot of yang burnout. And a lot of heat symptoms and dryness. You'll find a lot of yin stasis in people who do a lot of downers. Like think about it. People who do heroin, they tend to roll up into a ball, right? They don't come out. Cokeheads are blah, 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 blah. And in my family, I had both, right? I had heroin addicts and I had crack cocaine addicts. So I saw both, and you can see they're very different people, right? They're much different people, the way they react and interact with things. Even when they're sober, they're different people. And so they tend to move towards those different substances. So keep that in mind, because you're also treating the nature of the person in the process of this, right? So this can cause a reliance, right? Because obviously you'll get either trying to numb the pain or move towards pleasure and go out and accomplish, right? Type A people want to accomplish, want to succeed. So they take those substances that push them in their mind to feel like they're succeeding more. And this will create a reliance, right? To push them towards a feeling of pleasure or escaping the pain. You can also get the idea of obsessive repetitive addictions, right? And this can exhaust the jing. So what I mentioned is porn and masturbation addiction, sex addiction, and certain OCD tendencies. These things, this is just an example. And again, a lot of times people find this very uncomfortable, but I can tell you that I have had patients come into my clinic 20 something years old, and they've complained to me about erectile dysfunction at 28 years old. And you would think, like, at 28 years old, how would they have erectile dysfunction? And after talking to them, you realize they're masturbating 4 or 5 times a day. So they're exhausted. By the time they actually have sex, once they can't keep it up, so they're popping Viagra, right? Or something else. So this kind of is obsessive compulsive tendency to move towards and do this and do this and do this tends to exhaust the jing, right? So this is a very valid addiction, and actually uh, quite a far more common addiction today than I think people are willing to admit is sex and porn addiction. And this is very yang in nature, right? It's stimulating the genitals and stimulating Dumai, stimulating the liver channel, and on and on and on to eventually exhaust the jing, right? Because the goal of this is generally to orgasm, and with men at least, the ejaculation, too much of it can exhaust the jing. So you can find that in people, and they tend to become, even though they can be very young people, over time you can notice that they start to become more tired, more weak, and certain things are very affected, joints and whatnot, right? All right, long-term addiction. So continuous addiction can result in an increasing the use of the addictive substance. So oftentimes, oftentimes what can happen is the person starts off with lower amounts and then they end up moving up to higher amounts. Let me just like, sorry, I'm having trouble seeing this. Uh, so they can move up to higher amounts. A lot of times this increases addiction. The threshold for stimulation becomes higher, so the person wants to do more, right? Normally they're like, oh, I only do this amount, but after a while it doesn't work, so I got to do more. I got to do more. Tolerance for a drug or a behavior may lead to higher amounts, but it also going to lead to more dangerous actions. I'm willing to push the threshold of my dose, which could be more deadly now because I'm not feeling enough. I'm not getting the rush. I'm not getting the escape. I'm not getting the numbness, whatever it is. Higher doses, harder drugs, whatever they are, more dangerous actions, all of this can happen, right? So just keep this in mind. Many of you might treat addiction, and I commend you for that. A lot of people don't, because it can be a very uncomfortable thing, especially when you have people who are deep in that lifestyle coming to your clinic. Um, it can sometimes you can have very uncomfortable interactions. And so many people I know don't treat it, even though Chinese medicine is very effective at this. So a lot of people find loss of satisfaction. So after some time, people might find their addictive behaviors or substances no longer satisfy them. However, they can't let them go. It's just a thing now. It's like their habit. It becomes habitual. So it's no longer now about downers or uppers. It's a habit that's moved in. They can't let it go because it almost becomes an obsessive compulsive thing, right? It's not about the high I get. I need to do it because I have to do it because it's almost become part of me, right? And at this point, you can look at it as these addictions have moved into the source. They moved into either Dabao, the great low of the spleen, and they're now pushing into Ren and Du and even the Chong vessel, and they're greatly affecting the person's eight extras. If you guys remember from the last class, we talked about people who are affected in the Luomai at the level of the repressed, deep, deep, deep subconscious, right? Then you can have, in that case, an issue with somebody's emotions that are hard to tell if it's the person, or if it, like, say, if this emotion in this action is actually the person's nature, or if it's something else that affected them that's bound with the person's nature. This is an example of that. An addiction they can't get rid of, not because it's the upper or downer that they need, but because that addictive action has now bound with their nature, right? So this is where you're looking in, at this action combining with um their their essence, basically. So they cannot find satisfaction in addictive behaviors, but they can't stop, right? And this is really tough for a lot of people because it's very agonizing. They want to stop, but they can't because it goes beyond just the basic feeling of pleasure or pain anymore. it's like they can't exist without it. And so this can become another issue. So in that case, you'd be looking at the 8 extras to pull that out. So another thing to take into consideration when you're treating addiction are withdrawals. This is going to be a big thing I want to go over real quick before we jump into the lows. Withdrawals and the withdrawal symptoms can be very, very severe. At the time that somebody is going through, say if they come to you for addictive treatment and they go through withdrawals, you're probably going to have to treat them every day. And that might require you to sit down and talk to them and come to an agreement with them coming to you every day so they check in. And come for treatment to reduce those feelings of the withdrawals, to help them get through it. Even coffee addiction, sugar addiction, all these things have withdrawals, right? The body will crave sugar, and you can assist them in reducing those cravings and help them get through that serious withdrawal with the acupuncture. It works very, very well, right? So these are things you want to take into consideration. So a person coming off an addiction and going through withdrawals will find it difficult to calm themselves as the withdrawals begin. Why? Because you can oftentimes have a sedation of REN or hyperstimulation to do, and you get this overly stimulated or overly sedated thing, and the person finds trouble finding harmony between yin and yang in the body. So they have this hyperactive yang or this sedated yin, and it can't balance. It affects their mind, right? Because they can't find this calmness. And so helping them to bring harmony between yin and yang is really important. I say Ren and Do here as a channel example, but the concept of yin and yang in the body, of either picking them up and stimulating the yin to move, or calming the yang and grounding it, right? All these things. Also, we're going to come on to the idea of a lot of times through certain addictive processes, you get what they call zhang zhao, which is like the drying out of the organs, right? They're very dry and yin deficient. They get very irritable. The heart's very irritable. The liver's very irritable. And you have to nourish that. So you have to want to nourish the internal zangfu, and it will calm them down because it nourishes them and it balances yin and yang in the body. So these things are really important during detoxification processes. You can see a lot of emotions. You can see extreme anxiety, anger. People can snap. There's all these things. So in many cases, when I treated addiction, because one of my clinics at the time back in between 2010 and 2016 was in basically the heroin capital of Connecticut, which was a big, big heroin place. And my clinic actually was next to a gas station. And the gas station by the locals used to be called the Heroin Hess or the Murder Mobile. I was literally right next to this thing. And I would watch people buy heroin or cocaine or whatever they were doing on the stoops of the gas station next door. And so I was right in it. And we did have a couple of people from the neighborhood come and look for addiction help at the clinic. Um, in fact, when I went to China the first time I came back, and I had a bullet hole in the glass of the entrance to the door, and I had to have that replaced. I mean, that's how deep my clinic was, this one clinic that I owned in that area. And sometimes with these people, I would have to make deals with them to because they couldn't afford a lot. So sometimes you might have to adjust your prices to help these people out. And as long as they're willing to apply themselves, especially coming every day through withdrawals to get better, then in my opinion, it's worth it. So you just have to make that decision up for yourself because you're going to need to treat them to help reduce the emotions, reduce the cravings, reduce the withdrawal symptoms, the sweating, the shakes, all these different things. This is going to be the time where you're going to be treating them the most, right? So here we go, withdrawals called 脏糟, right? So this idea of this is the internal organs become dry and agitated during the withdrawal process. This can create a very physical or emotional agitation in the person. You have two major patterns that tend to occur. I'm not doing a lot of Chinese in this presentation because I just didn't have enough time to go through and put everything in. But some people in the past complained about it. So this one has more English, but this is one of the slides that is more Chinese. So we have 心前吃阳, which means the heart is deprived of nutrients, right? The other one is called 干前不足, or the liver and the kidneys are insufficient, right? Mm, they don't have enough blood and yin. And both of these can create a lot of deficiency. So when you look at patients who have this kind of visceral agitation, this irritation, they're very dry, they're very agitated. It seems like the heart pulse is thin, the kidney pulse is thin and very rapid. You're looking at these patterns and you need to nourish them by nourishing the blood, by helping to produce fluids. So dietary, herbal, acupuncture, all these things, massage to help push yin and fluids to the heart, to the liver, to the kidneys to help calm everything down. In some cases, you're looking to balance what? The concept of water and fire, right? Heart and kidneys and nourish the liver, right? So these concepts are things you want to look at, and everybody has their own way of doing this. I didn't give specific um, points for treating these patterns, but you can look them up and develop your own. It's obviously common things like you're going to look at the Hussey point of the liver and the kidney, right? They're both water. They're going to nourish the liver. They're going to help to strengthen the kidney, right? You're going to look at points for the heart, right? The heart Hussey point as well, kind of calm and nourish the heart. There's going to be different points you're going to use in the process of this. So we'll go over a few of those as we get to withdrawals later. So, like I mentioned, your focus for a lot of these withdrawal periods are going to be relieving heat. These people are going to get very, very hot because they're very, very agitated because they're not getting what they want, right? You're going to look to calm the heart, reduce anxiety, and also harmonize, whether it's T stagnation in the liver or the stomach. People can get very nauseous, right? So harmonization may take a bunch of different um, faces. So all of these things are really, really important when you look at people who are coming in and they're going to be going through this. And that includes drinking alcohol, right? Alcohol is very sugary. A lot of people with alcohol addiction are also sugar addicts. They come off the alcohol, they binge on sugar, right? Cocaine is another thing. People who are coming off of cocaine, whether it's crack or cocaine, they tend to move towards upper substances as a replacement in their diet. They tend to do a lot more sugar. A lot of cocaine addicts, when they come off, oftentimes have uh, hyperglycemic issues because they're eating so much sugar afterwards, and they get big because the cocaine that makes them not want to eat so much and gives them the go, 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 go energy. They look for it in another way that's not so illegal. And one of the ways they'll do it when they come off of cocaine is oftentimes become big sugar binging addicts. But that's also an addiction, right? So, yes, we say, well, that's better than this one. But are they really addiction free, right? It's something really to ask yourself in that process. All right. So I just wanted, this is a slide out of uh, the last class. I just want to go over this real quick, and then we're going to kind of pick up the speed here. So this is really important because what I'm going to talk to you about is a psychosocial emotional model of development. Now, this is the psychosocial emotional model is not something you find in the Huangdi Neijing. You find it in Taoist literature, in things like the Dao Zhang and things like that. And I learned this because I went to school at Swedish Institute. And so Swedish Institute was Jeffrey's actual college, Jeffrey Ewan, for you guys who don't know who he is. And so he taught us this model in school. And he said, listen, you're not going to find this in the Neijing or the Nanjing. This comes from the Taoist concept that we were taught through my oral tradition, but also in Taoist writings. But with that said, I study classical Chinese and I read the Huangdi Neijing and the Ling Shu, and I found that in Ben Shen chapter 8 of the Ling Shu, you'll find that correlation of the psychosocial development with the cognition of people. So in this case, you have the idea of somebody being conceived, the Jing mixing, you have the idea of the Hun and the Po going back and forth. Then the heart gets produced. And when the heart gets produced, you can then maintain memory. And when you have memory, you can develop intention. And when you have intention and memory, then you can develop will. So I translated this for you guys here myself. And from there, you can develop thoughts about things and understand what's this and what's that and make decisions. You're going to see this in the psychosocial model as really important because in the beginning, in the lung and large intestine period, young children, infants don't really have a ton of thoughts. They're just accepting everything, right? And it's overstimulating all the time. It's hyperstimulating, it's very sensual. You start to develop emotions at the stomach and the spleen level, and you start to be able to sort of have thoughts about the emotions. But then when it comes to the heart, that's when you really start to develop memories that have emotions that you can very clearly talk about. And as you go along, your body will develop in this way. So you can kind of see this as we go over the psychosocial model. So you can come back to this slide later and look at it if you want. But this chapter 8 of the Ling Shu actually relates to that development, even though you might not find the direct psychosocial model in the Neijing, right? All right, so psychosocial development. Like we said, the primary channels are a person's life. In some cases, the lomai are seen as offshoots. So in this case, we're going to, in the Ling Shu, they list the lomai in a specific order, right? They start with the lungs. They do like arm yin channels, and they do arm yang channels. They do leg yang and then leg yin. In this case, with the psychosocial development model, think of the lomai as offshoots of the primaries. And the idea is that the primaries are your major mental and psychological focus in life. But every time you have an issue or a trauma, the lomi are able to shunt that off. And so symptoms of trauma at a time when somebody's developing will be seen as empty or fullness of the lull, that those pathology in the lomi are affecting the development of the primary channel. Does that make sense? Does that make sense to everybody? I just want to make sure that that makes sense, and it doesn't. If not, I can repeat it and re-explain it. Yeah. Sorry, my thing doesn't allow me to see. Yeah, it makes sense. Good. Do you require the patient to be clean or sober when they come for treatment, or do you treat them even when they're high and they're drunk? I have treated patients when they're high and they're drunk. I prefer not to, but I have. In fact, I've actually developed, because I've had a number of family members who are uh, alcoholics. I think alcoholism runs mostly the biggest thing in my family. And so most people who are alcoholics, I've developed ways to sober them up very quickly within 20 to 30 minutes. Drugs are a little harder. I've treated people who are heroin addicts who are high on opiates, and that takes a little longer to sober them up. But alcohol, I can get somebody sober from blackout drunk in a half an hour. It's not that hard to do. So here we go. Let's see. Um, Here we go. So you're going to have this lomi, so it's going to be an offshoot. So we're going to see it as sort of a conjunction to the primary channel in this case. So we'll discuss the functions of the law as a channel, and then we're going to discuss the functions of the primary and the low as a channel together, and the pathological processes will be the lomi, right? So the development of those channels, if they're affected by trauma, can affect the way a person acts, right? This trauma will affect their development, and therefore the primary channel and the way you respond in your life will be affected. And those symptoms are seen as either an empty or a low, right? So this doesn't mean that trauma doesn't affect them in everyday life. So even though something's held in their subconscious, that subconscious can go back and kind of make you act a certain way because, say, for example, you're angry because of something that happened yesterday, and you wake up today and you are still irritated. You're not actively thinking about what happened yesterday. It's sitting in your subconscious, but the way you interact with people today might be influenced by yesterday's feelings, right? And that's why in Taoism, there's a very common meditation called the Zuo Wang, which means sitting and forgetting. And the concept of this uh, traces back to Sima Qianzheng and also to Zhuangzi and even Go Home. And they would say in these is that it's important to, at the end of every day, go over it in your mind and let it go and actively forget it. So that every new day when you wake up, it's a new day that's no longer connected emotionally, mentally to the previous day. You're a new person every day. And so this is the goal. We're trying to clear out these old emotions and old memories so that people don't have this stuckness that allows them to be their own person and move away from these addictive habits that they're holding them to their path, right? That's important. So the first level of psychosocial model is called survival. So this is a level of built-in survival abilities in everybody. Without them, you can't survive, right? So you have to have this develop in the very first uh, days and weeks and months of life, or else you, as a very young infant, will not survive. So these are the first ways you interact with the world, actively understanding yourself as an individual without even actively doing it. You're understanding it by living it, but not by thinking about it, if that makes any sense. So if these are affected early on, you can develop psychological issues within a person. So let's start with the lung channel. So when you're born, this is innately born into you, the wanting to reach out, to feel, to touch, to move around, right? An infant reaches out, they move, they touch themselves, they're moving around. They've been living for 9 months in water, in an ocean, right? In their mother, that's very, very thermoregulated, and it's very, very sensory, it's very, very sensual. But when they come out, they suddenly have a lot more light, a lot more dark, right? Things are much different. It's not so sedated by the mother's body. They feel a lot more. They roll around. They tend to, their eyes get big when they feel things, and they reach out, they latch right onto their mother's breast, right? When they suck, and they know exactly what's going on, in the sense of not like knowing cognitively, but knowing unconsciously. I do this and I accept the milk coming from mother. I don't necessarily spit it out and say I have a stomach problem. It just comes in. Everything happens. I can't fight against anything, right? This lungs relates to the skin, the nose, the sensory orifices in the sense of this. Life is very young in this way of accepting these things. So the lung channel is about experiencing and sensing these things in the world. You know that if infants don't have this kind of want to sense the world and want to reach out and connect, they tend to die very early, right? They don't really latch onto the breast. They don't really do these things. They tend to die very early. And the same thing is if you don't hold an infant out of the womb and they don't get touch, right? They don't get that feeling of sensation. They also tend to die very early, right? So this is very important in survival development of somebody. So the primary channel here starts at Zhongwan, right? Uh, Ren 12, and it moves outward. It moves down into the intestines and up and out into the lungs and up into the throat and then out into the arms. And it's about holding the world's experiences. This is this kind of Taoist metaphorical concept, but it's actually very literal about going out and feeling the world's experiences. Normally, our legs are pulled up and it's our arms to start to move first, right? Babies need to be touched to survive. So at first, the orifices of the baby and the skin is all wrinkled when they come out, right? You ever see a baby immediately when it comes out, and then over time, at first it looks, like a naked mole rat, right? It's like all skinny and wrinkled, and then over time, the lung yin, which is generated by the fluids, goes to nourish the skin, and the skin starts to unwrinkle and push out, right? A lot of times here in Taiwan and even China, they'll refer to the babies with like the big chunky arms that have just been born as mantou. It's like buns, right? And it looks like they have their arm is like a section of buns. And so, but over time, as the lung yin is generated by the stomach fluids and it pushes out, then you tend to have fullness of the skin. So this is all coming from the lungs, right? So when you have this is just for here in the future. When you have this, something can move from its fullness to its emptiness. So if you have an issue and it moves into the lung law, it can move from a full lung law. After a while, the law can't hold it because there's not enough blood or fluid, so it empties out back into the primary channel, right? Or it can move to the source, so it empties into the primary channel and you can push back to its source point or its yin yang pair. So example here, someone who is extremely excited at first is a lung fullness, wanting to engage. Then with time, they become bored, not wanting to do anything because their excitement of wanting to engage in life so much burns out. They can't hold it after a while because it's not being supported, right? There's not enough blood to keep supporting it. Maybe they don't feel like they're getting enough. It's an itch they can't scratch. We say in the lung low fullness, they have hot palms. They want to touch everything, but over time, they never feel that it satisfies them. So eventually, it becomes um, a an emptiness, right? Then after it becomes an emptiness, it can move to the source because the emptiness is what? The body dumping it into the primary vessel. And then you start to see the symptoms of that again. And then it can enter into the source and you can get tired with interaction, bored with life, people who don't want anything. Sometimes with this, people who have this in a constitutional, congenital manner, you can see this in people with mental retardation, right? Children with mental retardation, oftentimes early enough, don't want to interact with life, especially when they're babies. They're just kind of bored with everything, depending on the severity of the mental retardation. This can be seen as a lung source issue, right? Not wanting to interact with these things, right? So this is an example of how this can progress, right?